And a very good morning to you all. I'm Mabel, Jong, streaming to you live from the World Healthcare Congress out of Washington, D.C. Thanks for joining us. And in our studio, our very first guest this morning, Nelson Griswold, Next Gen Benefits Mastermind Partnership and Ascend Summit. Nelson, Mastermind Partnership. I like that. That just minces no words. You are leading a benefit revolution. Tell me about it.
Well, I work with employee benefit advisors. So these are the men and women who work with employers to help them provide their employees with health care and their benefits. For years and years, for decades and decades, health insurance has been bought the same way. It's been sold the same way. Advisors now, those who are part of this revolution, are changing the way they're doing what they do and helping employers change the way they buy health insurance. So for the first time ever, after years and years of increase every year, an increase in the cost of health insurance because there's an increase in the cost of health care, the clients that my advisors, the ones that work with us, are moving the needle down. They're actually reducing the cost of health care. So they're doing that, and they're also changing the way they're getting paid. So instead of taking commission from the insurance companies, they're charging fees to the employer, so they work for the employer, but they're also putting part of their fees at risk to guarantee results. Never been done before because no one thought you could actually get results in this business. The result was, instead of a 19% increase, I only have an 11% increase. We'll call that a win and we'll go play golf.
Okay.
Those are the old days. They're over. So it's really a revolution in how employers are buying health care and how the advisors are selling them and helping them manage that health care.
Well, spell it out for me. What does it look like, meaning the benefits packages, versus what they were before?
Well, the packages themselves don't necessarily change, but let me tell you how it's been. So if an employer, and almost every employer, buys computers for their employees, a company is now we need to get new computers. So they could do one of two things. They could take the corporate credit card and give it to every employee and say, go buy a computer. And one's going to go buy a $400 Dell. Somebody else, like me, is going to go buy a $2,800 Mac. Do I need a Mac? I may or may not, but should that be my decision as the employee to go spend $2,800 on a high-end computer? I may not need one. The employer may not be wanting to spend that money. Well, nobody does that with computers, but that's exactly what we do with healthcare. Every employee gets an insurance card. It's the riskiest corporate credit card in America because the employee can go to any hospital or any doctor at any time for any procedure and pay whatever is being asked, and the employer foots the bill. What we're doing now is managing that supply chain. So the advisors that work with us are making sure that, first of all, the employee actually needs that knee replacement. Could physical therapy get the job done and save the employee having to get surgery and saving the employer from having to pay for an expensive knee replacement? So second opinions. If the employee does need that knee replacement, what's the highest value, highest quality, lowest cost facility in the area? So the employee is incentivized to go there. All of a sudden, there's no out-of-pocket, no deductible, no co-insurance. You don't get this bill after your surgery. It's at no cost to the employee because the employer is saving so much by having them go to this lower cost but high quality facility. Better health care, lower cost. The benefits now cost the employer less, so they have more money for raises, to hire more employees, to buy that equipment that'll make the company more productive. So it's not really the benefit. The benefits don't necessarily change in terms of what the employees gets or sees. They just get better. So no out of pocket. Whereas today, employees are paying $3,000, $5,000 before the insurance pays anything.
Right.
Now the employee can avoid that by making the right choice and going to the right provider.
Are we seeing a revolution also in price transparency?
It's a big one, yes. Because right now, going to a hospital for a procedure is like going to a restaurant. The menu has the entrees and the appetizers, but no prices. Then when you get your bill, it's often, it would say, if you were in the restaurant, it would say dinner, $250. You say, well, it was two of us and we had hamburgers. How's it $250? Well, just, that's what we charge. Well, no one would go to a restaurant like that, but we go to hospitals where we have no idea what the cost is until we get the bill. The transparency is now on the front end. There are, and the World Healthcare Congress is fantastic in helping bring these innovators to light. But there are surgery centers like Dr. Keith Smith at the Surgery Center of Oklahoma, where he says, if you want a knee replacement, the surgeon, the anesthesiologist, the knee, the appliance, the replacement knee, and the facility fee, it's all bundled. One price, this is what you pay, it's a cash price. But oftentimes, it's no more than the employee's deductible would have been, so the employer would be happy to pay that. And by the way, if you want to go to Oklahoma, we'll pay your airfare, your caregiver's airfare, so you can take someone with you, and we'll pay your hotel while you're out there, because we're going to go from $60,000 to $18,000. We're happy to spend some of those savings getting you out there and putting you in a nice hotel and sending someone with you so that it's a good experience for you, the patient, because the company is saving so much. And that the savings, again, can be repurposed as wage increases. Americans have had 14% increase in wages since 1999. Sorry, 16%. 16% increase. At the same time, insurance premiums have gone up 193%.
Wow.
That's where their wages are. Employers are paying more. They're paying to the insurance companies. My advisor clients are bringing the cost of health care down so the cost of benefits comes down so the employer has more money.
You chaired a special track talking exactly about those things at the Benefits Advisor Leadership Summit. That seems like a meeting that should be at a benefits conference. Why do it here at WHCC?
Great question. World Healthcare Congress has been promoting these innovative cost containment and transparency strategies for years. And despite the great work the Congress does, the education the employers get, a lot of the providers get, the healthcare providers, there hasn't been a lot of movement in the market. And in conversations with World Congress Organization, I suggested it was because the benefit advisors haven't been part of the conversation. So the employer goes back and they say to their broker, I just learned about reference-based pricing, or I just learned about bundled surgery centers. And their broker goes to himself, I have no idea what she's talking about. So it becomes a bad idea. Or you're not ready for that. Oh, he doesn't even know what it is, but he can't do it. So it gets naysayed and pushed off. By bringing the benefit advisors here, the brokers, and educating them, they can then go back and have a conversation with their clients. Employers have an opportunity to call their advisor who might have come or might have heard about what we're doing here. And the advisor goes, well, I've heard of that. Let me look into it, as opposed to, I have no clue what you're talking about, so it's not a good idea. Right. So, and here's the other thing I'll tell you, Mabel. There's an interesting wall coming down. There's always been a wall between health insurance and health care. Big wall between. Health insurance would throw the money over the wall to pay for the health care, but there was no involvement with the buyer side, the payer, the employer. Employers are now using their benefit advisor to manage the health care delivery, the purchase of the health care, that health care supply chain, so that the cost can be controlled and lowered. So bringing advisors and employers together with healthcare providers is starting to make all the sense in the world now that this revolution is underway.
All right, Nelson, thank you so much for being here and sharing your thoughts. Really great to see you. And I'm Mabel Jong. Stay tuned. We have a morning of interviews to come.